What's up, St. Louis? It's your host, Luke Farrell of the STL Bucket List Show. The STL Bucket List Show is driven by Bomarito Automotive Group. Bomarito is Missouri's #1 car dealership with over 20 locations, so I guarantee that there's one in your neighborhood. Since the 1970s, Bomarito has sold over 1 million cars, and John and the entire team made us feel completely comfortable when we picked up our new vehicle recently for the family. So I can't thank the Bomarito team enough for driving this episode forward, and enjoy the show.
If you want to hear about St. Louis, tune into the Bucket List Show weekly. Hear what Marissa and Luke say. It drops every Wednesday. Got a dope new guest every single week. Buckle up for the ride. Who's it gonna be? Who's on the show today? They rep St. Louis. What to do in the loo on a late night, or maybe what to do on a date night. Yeah, Bucket List has you covered. They know what's going on. What's going on? They'll give you, hey, 18 different things to do, or 19 if you need one more to choose. Yeah, this city is a place we call home. A place we call home. Yeah.
Hey, what's up, St. Louis? We're going to take a quick break. I got my friends SSM Health in the studio today. One of my favorite people from SSM Health. We got the CNO of St. Louis University Hospital. We just visited you guys recently, but we have Jen Garnica. Thank you for coming.
Thanks for having me. My favorite place to come.
I know. She's famous. So in the last 2 videos we've done, her kids have seen the videos of her like on Instagram, and it's like not really her job, but it's fun to be on Instagram.
They think that I'm cool. So I think that's pretty awesome because I'm not. So
it is
it's
cool.
amazing.
The last video, I mean, it's just cool. Like we had the drone out there. We did just a bunch of fun stuff. But Jen, I was going to ask you if you can introduce yourself a little bit. Tell us about your role at St. Louis University Hospital. And we'd also love to hear your background in nursing and kind of your connection to St. Louis as well.
Awesome. Well, St. Louis native, I will answer the high school question that I'm
Yes.
sure you'll ask, which is a graduate of Afton High School. So
South
then,
County.
Started my nursing career, actually went to Forest Park Community College to get my ADN.
Mhm.
And I started with SSM Health in 2001. So I'm on my 24th year with SSM Health, which is kind of crazy.
That's incredible.
Yeah, I started as a student nurse and stayed there when I graduated. I decided to stay as a graduate nurse. Worked in surgical step down, kind of ICU, critical care. Decided to do almost every job I could do in nursing, and then sort of went into leadership, did administrative supervising. Then they said, "Oh, be a manager," and I said, "Oh, that sounds great." And then they said, "Be a director," and I'm like, "Oh, that sounds fun." And I just kind of kept going, and here I am, 24 years later, as the
So you've done
CNO.
everything there, though.
I have done.
You're one of the nurses, and especially with the same company as well. So
Yes.
you're not an outsider coming into
No,
this.
yeah,
You're like,
homegrown, and all of my 24 years have been with either St. Louis University Hospital or St. Mary's, our other hospital in Clayton. So yeah, I have had amazing opportunities. SSM has allowed me to expand and grow my career
mhm.
to where I am now, which is
Yeah.
amazing.
Yeah, that's incredible. So
Yeah.
for those who may not be familiar, can you give us an overview of what makes St. Louis University Hospital so unique? Because that is the place that you're at
That's
now.
where I'm at now. It's
Yeah.
beautiful. If
Yeah.
you've never seen it, it's on Grand Boulevard. We're only 5 years old, so it's a big, shiny, gorgeous. I liken it to the Four Seasons because I
Okay.
think it's so
Yeah.
beautiful.
It's very airy
Uh,
and light in
it's
there.
gorgeous,
Yes.
yeah. And we are about 500 beds now. We're kind of continuing to grow.
Mhm.
We are fully academic hospital. We're affiliated with St. Louis University School of Medicine. We're a level 1 trauma center. We do bone marrow transplant, solid organ transplant, CAR T therapy. We are Joint Commission certified for stroke. We do complex neurosurgery.
Wow.
We are a center of excellence for cardiovascular surgery and care.
Mhm.
We do just about everything. We have about a 500-mile radius of referrals that come from outside of just not only St. Louis County, but also rural areas that really need our highly specialized care. So we
Mhm.
take a lot of patients from outside all the way down to Cape Girardeau over into Illinois
Mm.
that really rely on us to take care of patients. So
Yeah.
we do a lot of really great stuff.
Yeah, when I was there, I saw the helicopter. And I
Yeah.
was wondering, I was like, where did they come from? And it was somewhere out in those smaller
Yeah,
towns.
they kind of come from all over, which in
And
those
that was to the
areas.
trauma center.
Yes, yep, to our level 1 trauma. So
Mhm.
yeah, we get a lot of business.
Yeah, that's incredible. So, with all that being said, what is it like to work at SLU Hospital? So, what sets the workplace apart for nurses specifically, and also other healthcare professionals?
So I have to give my go-to answer of the people first
Yeah.
of all, because I think that SSM just has an amazing culture. I think
Mhm.
everyone that works there is very committed, very compassionate, very mission driven.
Mhm.
But outside of that, as a nurse, you are the best of the best. So your skill set, ability to care for those high acuity cases,
Mhm.
you're in an academic medical center, so you're constantly learning in an environment with residents and other students.
Mhm.
Um, the ability to grow and learn in your profession is absolutely amazing. So we have so many nurses that start there and end up moving on and doing, they go to CRNA school or they're flight nursing. Or, I mean,
Mhm.
there's so many doors that are opened for nurses from being at SLU.
Yeah.
And many of them stay at SLU too because it's amazing. They may start on our neuro floor and decide to work neuro ICU or move into trauma. So there's just a lot of amazing opportunities. And I said our hospital's only 5 years old. It was actually designed by our staff, which was
Mm.
really great. So when you work there, your environment is conducive to what you need as a nurse and a
Right.
healthcare worker, which is really cool. We have all the high end technologies, lifts in every room. Like you
Mhm.
said, floor to ceiling windows.
Yeah.
It's bright. It's beautiful.
Mhm.
You have everything you need.
Because it was designed
Electronic.
by the people that are actually going to be
It
working there, not
was.
just by people that are looking to fit a budget or something
Exactly.
like
And
that.
as a nurse, you go to some places and you think, oh my God, who designed this? They
Yeah.
never worked in a hospital.
Yeah.
And then so our folks went in and said, yeah, that button can't go there. I can't reach it. Or
Right.
this needs to be over here. And so we actually when we built the new hospital, we made rooms out of styrofoam.
Okay.
It was pretty cool.
Yeah,
And
that's
they
fun.
moved everything around. And so,
Wow.
yeah,
And you were involved in that process
I
too?
was. Yeah.
Yeah.
It was really cool. So the
Yeah.
nurses told us what they needed and
Mhm.
our physicians and other providers. And it makes that environment really, really conducive to working as a
Mhm.
nurse.
And that's helpful because, it's not, you know, working conditions are super important, but then also you mentioned the people, and I always stick to like people make companies,
Yeah.
and when you go to work and you love what you do, that's one thing, but then when you also have friends that you call your friends at work,
Yeah.
and I noticed when we were walking around the hospital, about a month ago, everybody from the lunchroom all the way down to trauma, all the way upstairs to some of the other spots, like everybody knew each other. You were talking to some of the
Yeah.
doctors. I got to meet one of your guys' doctors there, which was pretty
Yeah,
cool.
Dr. Freeman.
Yeah,
He's
Dr.
our
Freeman.
head of our trauma.
Yeah.
So
So
yeah.
it was just really nice. And like everybody, it just seems like it's more than just a hospital.
Yeah, it feels
Yeah.
like family. When you
Yeah.
have to go to work and spend so much time there, it
Yeah.
really feels good to be with people that care about you. And it
Mhm.
is fun when you walk in the door from
Mm.
security to housekeeping or dietary or
Yeah.
nursing or physicians or residents. Everyone's waving and
Yeah.
saying hi and
Hmm.
how was your day? And they really come together for each other too. And
Hmm.
when there's
Celebrate each other's wins
celebrate
in life.
wins, they're
Yeah.
there when they need each other, which
Hmm.
is really amazing. Just a really great atmosphere. We're, like I said, not a huge hospital. So you get all the really high acuity, highly skilled
Hmm.
um, things to do as a healthcare provider, but it's in a small town sort of feel, which
Yeah.
is really fun.
Yeah.
So
That's great.
yeah.
So when I was leaving there, I was looking at Cardinal Glennon. I was parked in the
Hmm.
garage. I was in the garage off by the main entrance. So like as I was walking through the garage, I could see the work
Yep.
getting done. So obviously it's a huge project. It looks unbelievable. I've
Yeah.
seen renderings of what it is going to look like. But can you tell us more about how it connects with St. Louis University Hospital?
Absolutely. Well, first of all, there is a new level every day. So when
Yeah,
you come back,
they're
it's
moving
going to,
fast.
I mean, it's so fast. It's
Yeah,
crazy. I look out my window and I'm like, oh my gosh, there's a whole nother
yeah,
story there. It's going to be gorgeous. But
yeah.
yeah, so we are currently connected to Cardinal Glennon. They're part of SSM. That's our pediatric hospital. And we will continue to be connected. So when I say connected, I mean physically connected. So we actually have tunnels and walkways that
Okay.
connect us. We have a lot of shared services and overlapped services,
Hmm.
which is really important because sometimes we're providing dual care. There are often adult patients that have grown into adults because we do such amazing work. They started at the pediatric hospital, and so we combine sort of our providers and teams to take care of those patients.
Okay.
It also gives our nurses and our staff a lot of great opportunity to see both sides of that and
Hmm.
connect and go back and forth.
Hmm.
We also love to visit each other's cafeterias.
Yeah, that's cool.
So we're excited about the new one,
Yeah,
and they're going to have great green space
nice.
and
Get some different options. You're like, ooh, I want to go
yeah,
eat over
and it's
there.
beautiful as well. So
Yeah,
now Grand Boulevard will be covered with these big, gorgeous, beautiful hospitals, which
yeah.
is really fun.
Yeah, that's amazing. Yeah, it looks like, I mean, they had big signs up, big cranes up
Yeah,
there. So when is the projected date?
2027 is
Okay.
when they should be done and open and ready to go.
Oh, wow. Yeah.
Yeah.
And
So
it's
and they're
been,
going fast. It
yeah,
is going really
it's been in
fast.
the works for a long time.
Yeah.
So I want to talk about career opportunities. A lot of the people that follow us are younger adults that live in St. Louis. Are there any specific specialties or roles that the hospital is currently looking for that you
all
can speak on?
all of the above.
Yeah.
Obviously, nursing.
Yes.
Imaging is huge. We have
Mhm.
a lot of opportunity in the imaging space, in our surgery space, surge
Mhm.
techs. That's really highly in demand right now. But the thing I would probably just make sure that folks know about is sometimes people think because we're a hospital, you have to have a degree or a license already to work there. And that's not necessarily the case. We have a lot of great entry level positions. Again, in EVS, food service, registration. There's a lot of spaces that support patient care that's not necessarily nursing
Mhm.
or being a physician. So I would encourage folks to check those out as well because we need help in all of those spaces.
Mhm.
But definitely nursing. It's a great way to get in the door too if you're interested in
Yeah.
healthcare and maybe you just don't know where to start. We
Mhm.
do have tuition reimbursement. We have career ladders, and so maybe you haven't done it yet, but you can get your foot in the door, start working, and then
Mhm.
use our benefits and go back to school and do
Mhm.
something that you want to do. And
Yeah.
again, SSM's an amazing organization, homegrown, 24 years,
Right.
so
Right.
lots of great opportunities. But definitely, as a nurse and the CNO, I will push for nurses.
Yeah,
So
of course.
we're the best place to work if you're a
Mhm.
nurse. Lots of flexible options
Mhm.
and great place to be. So
Yeah. So if people are looking to connect with you guys, obviously you have the social media now, SSM Health Jobs.
yes.
You can just send a DM, talk to one of your nurse
Absolutely.
influencers.
Yep. We have influencers that are on monitoring that all the time.
Okay.
So absolutely connect with us on social media.
Mhm.
We also obviously can go to jobs.ssmhealth.com as well
Mhm.
if you're a website visitor. So I
Yeah.
think social media is a little bit more popular these days.
Mhm.
But yeah, absolutely reach out, even if it's just a question or maybe I'm interested. We love people to come take tours
Yeah.
and come shadow and just see
Mhm.
what we're like. Looks beautiful from the outside, but you got to see how gorgeous it is on the inside
Of
and
course.
meet our amazing people and be part of our
Yeah,
team.
it really was. It was my favorite part was the trauma center, just like how connected it is with the helicopter pad, and then you get this beautiful skyline of St.
Yeah.
Louis. When we were up, I think on one of the top floors, we
Yeah.
got to see that same view. So they were thinking of that view of the arch the whole time when
Yeah.
they were building it.
Well, just think of
Um,
working if you get to stand there and you
mhm.
get to do the best job in the world, which is taking care of people, and you get to have that beautiful view in the background.
Exactly. Instead of like
Pretty
a
amazing.
white room with no
Yeah.
windows, which some of
Yeah.
us work in, and it's like, oh man, it's like so dark in here. You walk outside, you don't even know what time it is.
Right. Yeah. And when it snows, I will tell you, it's
Yeah,
really pretty from the hospital. You
yeah.
get to see the arch, and
That's amazing. And you're
it's
on
pretty
Grand, you're in a
beautiful.
historic part of St. Louis. You have, the fabulous Fox, right
We
across the highway from you
do.
guys and
We have a new
um,
Target right
the
by
Target
us.
right there. If
Top
you need to run
Golf.
to a Target, do a Target run on the way home.
Exactly. You gotta
Yeah.
grab milk or cereal on the way home. I forgot
The
the eggs.
Topgolf City Foundry, all these like amazing things, and
Yes,
then so many like options for people to live so close to work because I know some of the
absolutely. The
younger
Grove
nurses.
is right behind
Yes.
us. We have a lot of nurses, really young,
Hmm.
love sort of that midtown
Yeah.
vibe, and we're right there. By the way, our employees don't pay to park, which is another perk.
Oh, that's great.
So yeah,
Yeah.
so they can park. They don't have to shuttle anywhere if they don't want to. Walk right into the hospital.
Yeah.
Like I said, a lot of them live right around that area, and there's so many great things in Midtown.
Hmm.
So it's a great place for us to be located.
Yeah, that's amazing. Well,
Yeah.
Jen, I appreciate your time. Thank you for, visiting us, taking your time, of course, giving me a tour of SLU. It was so good. I had to have you on the podcast.
So happy
Um,
to be here. Thanks for inviting me.
but yeah, we'll share out the links for you guys, and of course, if you guys have any questions, my best way would just go to SSM Health Jobs on Instagram, TikTok, Facebook, and you can just send a message. I know
Yep.
sometimes it's hard to go to websites and like you have to commit to a
Yeah.
whole form. It's like, hey, just send a DM.
Yep.
And one of the people that are actually in house will take care of you. It's not an automated service or anything like
No,
that.
those are
So
human beings
yeah,
and they will reach right back out.
cool. Well, thank you
Yeah.
so much, Jen.
Thanks. Always great
And
to see you.
yeah, we'll see you next week, guys.
Yep.
Today they rep St. Louis, yeah. They rep St. Louis. They rep St. Louis.